If I was to just put it briefly, you have this machine that sends out waves that are sonic in nature that you can't see with your eyes, and then they hit the tissues in your body. If it's a baby, if it's, let's say, your intestines, and then they're reflected back. So the probe has a component that's able to capture the difference of what was sent and what was received. And it's that difference that now creates the images that we see on the computer screen.
MScan Uganda is a social enterprise developing and deploying low-cost, portable ultrasound devices designed for resource-limited settings. The initiative aims to reduce maternal mortality by making life-saving diagnostic imaging accessible to pregnant women in rural and peri-urban areas.
Traditionally, we have the big conventional ultrasound machines that are bulky, expensive, to a tune of about 10 to 50,000 US dollars. And this can be maneuvered in remote places where most of our mothers actually give birth. So MScan, after realizing that we're losing 19 mothers in around 2019, we developed something that's portable, that's power efficient, that will actually reach out to these mothers where they are. And out of that, we built something that, with the software on a laptop or phone, you just plug it in and you're able to scan a mother anywhere.
Dr. Prosper Ahimbisibwe, co-founder MScan Uganda, reveals that over the last 8 years, they have reached more than 13,000 pregnant mothers who would otherwise never have accessed or afforded an antenatal sonogram. This is a life-changing innovation and the real solution to maternal-related death.
At the recent National Safe Motherhood Conference last year, the Ministry of Health reported that only 23% of all pregnant mothers were accessing an antenatal sonogram. And that includes, all the people in Kampala. Now, we with our portable, ultrasound machine, and with the training and upskilling of an experienced midwife, we're able to equip these frontline healthcare workers with this technology, we're able to pick these risk factors, and then we're able to identify them quite early, and either they can be given special attention at these facilities, or these mothers can be referred earlier on and receive the intervention, and hence cutting on the 3Ds that are the biggest, in upping the maternal mortality that we have in Uganda and Africa.
By using an OTG cable and a custom-built application, any laptop or smartphone can be transformed in a diagnostic tool. The device is used together with ultrasound gel, which helps sound waves travel more effectively during scanning.
So instead of having the big machine, you only have this that you can carry in your bag, even your pocket. And then with a laptop, can even be a personal laptop, you're good to go. So with the gel, it helps the sounds move much better and also the reception much better. If I'm just to demonstrate on my perm, just briefly how this works. Of course, if the lady was pregnant, we're still suspecting, but we don't know. You know better. But yes, you see with this. So as you,
the gel they put on the tummy.
Yes, on the tummy. So if I'm just to show you, these are tendons. What you see there black is the tendon running.
MScan enables the early detection of complications that often go unnoticed until it's too late. Currently, the team operates a lease model with private clinics. Given the high cost of conventional ultrasound machines, the goal is to make antenatal sonograms affordable and accessible for pregnant mothers in peri-urban areas.
I would say one we've emphasized beyond just the portable ultrasound. We have a partner who provides these gadgets that they need, so a laptop and a tablet. 2, we upskill frontline healthcare workers, experienced midwives, and we've trained over 10 of them. Then also, as mentioned, we also have a lease model with private entities. Then now we're in partnership with the Ministry of Health, and now we are looking at scaling from the 16 facilities to over the 2,000 health center 3s that actually have maternity wards, and mothers in these regions actually need our solution. So we not only innovate in the product, but also innovate in the way we deliver this innovation to communities that need it.
Dr. Prosper also notes that the medtech innovation is regulated by the National Drug Authority and assures the public of its safety for medical use.
Every medical technology is regulated, highly regulated by the National Drug Authority. So as you import or build any technology, there are clinical trials that you do to demonstrate, on human subjects, the exposure with this technology. And also there's a classification with every medical device and medicines. And so the ones that are invasive, class 3 and above, these are ones that now the National Drug Authority pays attention to. And ours is non-invasive, so it's just ultrasound technology. The only exposure is maybe the long use of the probe, and it heats up. We allow about 30 minutes between every 6 hours of scanning to just let the probe cool, and then we can start again. But it's important to make sure the technology we build are safe for human use, especially for us sensitive areas of healthcare like maternal health. We're dealing with the mother and the baby.
The devices are specifically designed to be power efficient and ultra affordable, addressing unreliable electricity and the high cost of bulky conventional machines in upcountry Uganda. This homegrown innovation is now gaining global recognition, proving that when technology meets empathy, even the greatest challenges can be solved.
It looks simple, but for women in rural Uganda, it's a lifesaver. With M-Scan, midwives can now perform prenatal ultrasound on the spot using just a smartphone. This local innovation is bringing care closer and saving lives. Joram Paul Sonko, NTV Innovation Nation, Chambogo, Kampala.